Welcome to the deep dive. If you've been following the buzz in mental health, you'll know psychedelic-assisted therapy, or PAT, is gaining serious attention.
It really is.
And it's crucial to understand right off the bat, this isn't about recreational use. We're talking about a structured medical approach.
Exactly.
Today, we're diving into how it works, drawing on some great insights, including principles from Dr. Nader Attalla's work, to see how it's achieving, well, pretty profound healing.
Yeah, what's fascinating, I think, is we'll look at why it seems to work where other treatments sometimes haven't. You'll see it hinges on a really careful process.
Okay, so let's unpack that. PAT. It's this blend of neuroscience and almost ancient healing ideas, but in a very controlled setting.
That controlled setting is key. The difference between this and, say, someone taking psychedelics on their own, well, it's vast.
How so?
Think of it like this. POT is a guided expedition with experienced navigators. Recreational use might be more like wandering alone in, an unmapped wilderness. It all comes down to set your mindset and setting the environment to support.
Right, the guides, the preparation.
Absolutely. Trained professionals, a safe space, it changes everything.
So tell us about this guided expedition. What's the structure like? You mentioned a process.
Yeah, it's generally broken down into 3 distinct phases. Super important, each one.
Okay.
First step is preparation. This isn't quick. It's about building trust with the therapist, setting clear intentions, creating what you might call psychological safety nets.
Like checking your gear before a big climb.
Exactly like that. A mountaineer checking everything meticulously. Then comes the psychedelic experience itself.
Core session.
Right. But it's carefully planned, supervised the entire time by professionals. The goal is for it to feel safe, comfortable, even amidst potentially challenging experiences. The guides act as compassionate witnesses, skilled navigators.
Okay, and it doesn't just stop when the substance wears off, does it? There's a third phase.
And arguably the most crucial, integration. This is absolutely vital.
Why is that?
Well, these follow-up therapy sessions are where you process the experience. You work to kind of weave any insights or breakthroughs into your actual daily life.
Yeah.
Without dedicated integration, those big revelations can just
fade away.
Say, like vivid dreams, leaving very little lasting change. Integration grounds it.
That makes a lot of sense. So with this careful structure, what are we seeing in terms of results? The sources suggest they're pretty remarkable.
They really are, especially for conditions like treatment-resistant depression or PTSD, where, frankly, traditional methods often struggle.
Right.
We're seeing studies, for example, where psilocybin-assisted therapy gets like 71% response rates for depression. And MDMA-assisted therapy for PTSD figures like 67%, even up to 88% of participants no longer meeting the diagnostic criteria after treatment.
Wow, after just a few sessions.
Often, yes. It's less like fine-tuning an old radio and more like installing a completely new sound system, helping to build new neural pathways.
Those numbers are definitely compelling. But are there caveats? Is it suitable for everyone? What do the sources say about challenges?
That's a really important point. It's incredibly promising, but definitely not a magic bullet or suitable for absolutely everyone. There's careful screening involved.
Okay.
For instance, conditions like active psychosis are typically contraindications.
Yeah.
And it requires a real commitment from the person undergoing therapy. It's an intense, rigorous process. It needs to be done carefully, clinically.
Got it. So which substances are leading this research, and how do they differ?
There are 3 main ones currently at the forefront. Think of them as specialized tools.
Okay.
There's ketamine. It's often called the neural reset button.
Neural reset button. How does that work?
It temporarily disrupts some of the brain's usual connections, sort of like disconnecting faulty wiring for a moment. It creates a window, allowing new patterns to potentially form, like a fresh snowfall covering old, worn paths. It's quite rapid acting.
Interesting. And the others?
Then you have psilocybin, the active compound in magic mushrooms. This one's sometimes called the emotional archaeologist.
Why that name?
Because it can help uncover buried emotions, maybe forgotten memories. People often report quite profound mystical or transcendent experiences, too.
Okay, and the third?
MDMA. This is often termed the heart's ambassador. It tends to foster empathy, emotional openness, and really deep feelings of safety and connection.
Which sounds crucial for trauma work.
Exactly. It can allow people to revisit traumatic memories without being overwhelmed by fear or shame, often with a newfound sense of self-compassion.
So these substances create these potentially profound experiences, but you mentioned integration is key for lasting change, and the sources bring in these 7 principles here.
Right. The experience itself is powerful, but it doesn't automatically stick. These principles, non-attachment, non-judgment, acceptance, unconditional love, powerlessness, gratitude, and hope, they act as the scaffolding.
Scaffolding for change. Essential scaffolding, yeah. They're tools for both preparing for the experience and for integrating it afterwards. What's fascinating is how the psychedelic state can sometimes make these principles feel, well, viscerally real.
How do you mean?
Well, take non-attachment. Intellectually, we might grasp it. But during an experience where the sense of a separate self might temporarily dissolve, you might feel non-attachment, that sense of interconnectedness, directly. It shifts from a concept to a lived reality, even if just for a time.
I see. It accelerates the understanding.
It can, yes. It provides a direct lesson that integration then helps you practice and embody.
So, wrapping this up for our listeners, PD isn't presented as some kind of quick fix.
Definitely not. It's more like a powerful spotlight, isn't it? It can illuminate your deepest wounds, yes, but also your inherent wisdom and capacity for healing.
And these principles, they're like guides for navigating what that spotlight reveals. Trusted companions, really, helping you walk into it with courage and walk out with clarity to build on. The real transformation isn't just in the session, it's in how these ways of being non-judgment, gratitude, acceptance slowly become more your natural state in the world.
So the invitation for you, listening, is maybe to consider, how could practicing these timeless principles, whether PET is relevant for you or not, start to shift your relationship with challenges, with meaning, with what's possible? It's about cultivating that lasting well-being day by day.